Recovery from labiaplasty really depends on the first 72 hours. And this is where you can make or break your overall recovery for 6 weeks, because swelling plays such a big role in discomfort. And so if you can prevent swelling from the beginning, then your whole 6-week recovery is going to be much, much easier. So typically I have folks go home. I know you feel good. I know that you're numb and you're comfortable, but I want you to go home. I want you to lay down and get your hips elevated above your heart so that way we're preventing swelling. I also do icing, and 15 minutes on, 15 minutes off, taking care not to have ice on too long, but certainly trying to prevent swelling. Once you get past 72 hours, then folks are up and going and they're comfortable because that swelling hasn't really occurred. So they're able to do more of their activities that they like to do. As far as restrictions, I really want to be careful with patients. I don't want to have them lifting heavy things. I don't want them having sex. And quite frankly, you're not going to want to, because this is a very tender area afterwards. But in addition, you want to really not do a lot of exercise, because any sort of leg walking, riding a bike, certainly you would be sitting on that area, would be very painful. But there's a rubbing factor that is very, very uncomfortable. And so we really like to have people hold off on these activities for about 6 weeks until the labia is healed and can tolerate any sort of pressure or rubbing and be more comfortable. The nice thing also about this is that all of the suture that we use is dissolvable, so you don't have to come back to have that removed. And so all of the suture's going away. And so it's not a painful experience. It's just at some point it's all gone, and now you're back to all your activities. One of the big things is, how do I care for this, that people want to know? And it's really very simple, but remember, this area is very, very tender. And so going to the bathroom and trying to wipe yourself afterwards is not a pleasant experience in the very beginning. So in the first week or so, I typically will have folks rinse with a soapy water irrigation. And then once that's done rinsed, then use a clean water irrigation just to get the soapy residue off, because it will make you itchy if you leave soap on your skin for a while. So doing that, and then after usually by about a week or two, you can gently pad yourself with toilet paper and you're comfortable. Certainly having a bowel movement is not affected because this isn't really in the area, but we do encourage really good hygiene with that as well to help prevent any infections in the surgical area.